Hello and welcome to class 3 of functional analysis. Today we are discussing temporomandibular joint, clinical examination and palpation. I am Dr. Mugdha Mankar and this channel OJHEP Finishing School focuses on orthodontic education and experiential learning. So if you are interested in this content, do subscribe to my channel OJHEP Finishing School. Now continuing with TMJ clinical examination and palpation. The temporomandibular joint clinical examination is divided into 3 steps and they are auscultation, palpation and functional analysis. Coming to lateral palpation of the temporomandibular joint. Using your index fingers, exert slight pressure on the coronoid processes on both sides simultaneously. During examination, register if there is any tenderness to palpation over the joint area or there is any irregularity in the condylar movement while opening and closing the mandible. The joint area is now checked for any pain on pressure. At the same time, it needs to be assessed whether the right and left condylar heads are moving in synchronization during the opening and closing mandibular movements. Posterior aspect of the temporomandibular joint is then examined by using the little fingers and inserting them into the external auditory meatus such that they are just approximating the posterior surface of the condylar head. Again, palpation is done during the opening and closing movements of the mandible to record if there are any irregularities in the condylar movement and synchronization between the right and left side condylar movements. Muscle examination and palpation forms a very important part of functional analysis. This involves not only the muscles of mastication but also the entire face, head and neck to detect any pain points. The fan-shaped temporalis muscle is palpated on the side of the head bilaterally and extraorally. Asking the patient to gently clench their teeth intermittently tightens this muscle and allows you to palpate the muscle starting from the temporal fossa, going above and behind the ears and then extending towards the forehead. Fingers can gently press and move along the surface of the muscle while the teeth are being clenched and relaxed intermittently to assess the texture of the muscle, to detect any tenderness, and to compare the tonicity of the muscle between the right and left sides. Intraorally, trace the anterior border of the ramus of the mandible with a finger upwards until you reach the coronoid process. Extraorally, keep another hand at the same place. Ask the patient to open and close and try to feel the inferior fibers and the tendon of the temporalis muscle as it gets inserted over the coronoid process. Palpation of the temporalis muscle can help in detection of TMJ disorder, which affects the temporomandibular joint and the associated musculature. Next is the masseter muscle. Gently press and move your fingers on the side of the face, starting from the zygomatic arch and moving slowly towards the angle of the mandible. The muscle can be palpated by either gently pressing on it or by pinching the muscular belly. Gently clenching the teeth intermittently makes the superficial head of the masseter muscle prominent and easily allows to assess the extent of the muscle mediolaterally as well as superior inferiorly. Again, assess any tenderness or pain trigger points and tonicity of the muscle. During opening and closing movements of the mandible, compare and assess the strength and tonicity of the muscle bilaterally. Reduced muscle tonus and flexibility or pain trigger points in this muscle can be associated with TMJ disorders, occlusal interferences and disorders including malocclusion and also bruxism. The inferior head of the masseter muscle can be palpated using an intraoral method, holding the cheek between the thumb and the index finger, starting from the ramus and moving towards the midline, gently pressing along the width and length of the muscle. The lateral pterygoid muscle is considered quite difficult for intraoral palpation. The muscle lies deep intertwined with the superficial fibers of the medial pterygoid muscle, the temporalis muscle, and often shows anatomical variations. Good anatomical knowledge regarding the position and function of this muscle is necessary for successful intraoral palpation. The intraoral palpation method of the lateral pterygoid muscle includes passing a finger behind the last molar parallel to the alveolar ridge of the posterior molars and slowly reaching the pterygoid plates. Moving gently upwards and inwards in this area and asking the patient to slightly close the mouth so that the superficial structures in the subtemporal fossa becomes relaxed and the finger can push ahead towards the lateral pterygoid muscle. The lateral pterygoid muscle can be easily confused with the superficial fibers of the medial pterygoid as well as the temporalis muscle, as I said earlier. In this position, ask the patient to open and close and gently move the mandible sideways. This will lock and unlock the lateral pterygoid muscle and help distinguishing the lateral pterygoid fibers during assessment. Again, assess tenderness on palpation, any pain points, and compare the muscle activity on both. The lateral pterygoid muscle could be quite painful if involved in temporomandibular disorder, so this assessment and palpation needs to be gentle and slow. Next, extend the head and palpate the posterior digastric inside the angle of the mandible. Depress the neck and then palpate the anterior digastrics behind the chin. Next, move the fingers towards the side of the neck and run down, gently pressing over the platysma and then the sternocleidomastoid muscle. Moving the lower lip downwards and sideways make these two muscles prominent and help in their identification during assessment. Here we finish the temporomandibular joint area assessment through palpation. If you have any doubts or suggestions regarding this video, do post them in the comments section. Like and subscribe this channel, and you can also mail me at ojfinishing@gmail.com. Thank you.